Good afternoon. We'll start with comments from Dr. Joffe, then move into Q&A.
Good afternoon, everyone. For more than 2 weeks now, our public health experts and our incredible frontline healthcare providers have been doing everything they can possibly do to look after those impacted by this terrible outbreak of E. coli. This includes caring for sick children in hospital, making them as comfortable as possible, while also providing support and words of reassurance to their understandably distressed and anxious parents. And it also includes an intricate and comprehensive investigation into the outbreak source, proactive closures of daycare facilities where appropriate, and the meticulous investigating that has helped us to limit transmission of this E. coli bacteria. This has been a challenging and very difficult time. And as I said last week, we're still not out of the woods. However, we are encouraged by falling daily case numbers and a sustained decrease in children who require hospital care. We're also not seeing any significant spike in secondary cases. This is a cause for cautious optimism as we move to what we hope will soon be the end of this extremely serious outbreak. That said, our thoughts remain with those children who have not yet recovered enough to go home, with those parents who sit bedside looking for signs that their child is on the mend, and with anyone who is impacted by daycare closures. Today's numbers continue to trend in the right direction, but we must remember that these are not just numbers. These are Albertans, most of them under the age of 5. As of September the 19th, there have been a total of 348 lab-confirmed cases connected with this outbreak. This is unchanged from yesterday. There have been a total of 27 secondary cases. Encouraging news, as there have been no additional secondary cases confirmed in the last 48 hours. It should be noted that some secondary transmission is common, and in fact, it's expected as part of a large outbreak such as this. Our aim, though, is to limit that transmission as much as possible. There are currently 8 children receiving care in hospital, 1 less than yesterday. All of these children have been confirmed as having hemolytic uremic syndrome, including 2 that remain on dialysis, 1 less than yesterday. Those children with more severe illness are in stable condition and they are responding to treatment. Our frontline healthcare teams continue to provide them with the very best of care and support possible. A total of 707 children connected to this outbreak have been cleared to return to a daycare facility. There are currently 6 daycare facilities under closure or partial closure since September the 15th, as instructed by AHS Environmental Public Health. Closure orders were rescinded for classrooms 3 and 4 at Vic Academy in Calgary the afternoon of Monday, September 18th, following negative test results for E. coli. I acknowledge that the closure of a daycare creates incredible stress for parents. Suddenly, they're faced with either taking time off work or finding alternative arrangements for their kids. This is not easy, and the temporary closure of a daycare is not taken lightly. I cannot stress enough how important it is for people to follow instructions from public health about what they should do before their child can safely return to daycare. It is crucial for parents with children that attend daycares to follow this guidance and the guidance that's provided to them by healthcare professionals. If your daycare is closed, please respect why this is done and keep your children at home. Only send your child to another facility if they've tested negative for E. coli, if they have no symptoms, and if they've been given clearance from AHS. To all daycare operators in the Calgary region, please confirm the health and the daycare history of children who are new to your facility. This will protect you, your staff, and most importantly, the kids in your care. It is vitally important that these requirements are adhered to limit transmission and to prevent more people from falling ill. By working together and by following health guidance, we will stop this outbreak. The public health investigation into this outbreak continues, and we are hopeful that we are getting closer to understanding how this outbreak occurred. Our public health team is reviewing the food histories for more than 1,150 children and 250 daycare staff. This includes both those who became ill as well as those who did not, all of whom were at the 11 affected daycare sites between August 15th and 31st. By comparing the complete food history from both groups and then combining that with what is known about how food items were prepared and distributed, the team can potentially identify commonalities and ultimately identify the likely source of this outbreak. We anticipate having an update on this work very soon. I would again like to express my heartfelt thoughts to anyone impacted by this situation. And I want to reassure Albertans that your public health teams are doing all that they can do to get to the bottom of what happened here. My hope is that we will continue to see children recover and that their lives will soon return to normal. Thank you.
We'll now move into the media Q&A. You'll have one question, one follow-up. We'll start with those in the room before we go to the phones. Before you begin your question, please identify yourself with name and outlet. And with that, we'll start with the first question in the room.
Dean from Canadian Press. Can we just discuss the investigation a little bit more? And I'm sorry for the front-end loaded question. Is it a matter of we will find out where the cause of what the cause of this is, or is it possible that we may never be able to pinpoint it down? And if we can't pin it down, what's the knock-on effect of that? So, for example, would that tie your hands in terms of orders that you could be able to give this kitchen down the road?
So we are doing everything we can to identify exactly how this outbreak occurred, what happened, when it happened, why it happened, and then ultimately that will help us to prevent the next outbreak from happening. It is possible that we are never going to know the exact source of the outbreak, but we are doing our very best to narrow it down, and again, that will inform future steps and future prevention.
Thanks, Dean. Follow-up?
Well, but my second part of my first question, though, was will that tie the government's hands in terms of orders for the kitchen and that sort of thing if we never get to the exact source? Does that affect us legally, I suppose, is my first part of my first question.
Again, we're trying to identify the cause. This will help inform future prevention strategies. There are some standard food safety approaches that will be re-emphasized, and there's a lot yet to come, and you'll be hearing more about investigations and education in the setting.
So my second question then would be, what's going to happen with this kitchen? It's been 2 weeks now. The daycares have been allowed to reopen. Well, I assume nothing's going to happen until you figure out whether or not there's a source with this kitchen. But what's the plan for this kitchen down the road? Will you allow this kitchen to reopen? And if so, do you have the legal authority to put up in multiple inspections? Would there be other orders that you could put onto this kitchen? What's the plan for this kitchen going forward?
So the original outbreak in Calgary impacting 11 daycare sites were linked to a central kitchen, which you're referring to. That kitchen is closed indefinitely, and I can't really say anything more about that at this time, but it is closed indefinitely.
Okay, next question in the room.
Linda Smith, Globe and Mail. I wanted to follow up on Dean's question. You're saying that it's, indefinitely. That's the word that you guys keep using. But there must be some sort of plan or procedure that you have to follow when something like this happens? How long can you close it indefinitely before you just never open it again? Like, what are the steps that you guys are taking to figure out, will it reopen again? If it doesn't reopen, what happens? If it doesn't reopen, we can close it.
I think there are a number of steps in the works, but for now, that facility is closed indefinitely. There are no plans to reopen it. Should there be a plan to reopen it, then we will need to address all of the questions you've just asked.
Ellen,
And
a
then,
follow-up.
my second question, I think, is for Minister LaGrange. Premier Smith has said that, we don't know what form an investigation from the government will take, but I'm wondering if you could be more clear, what's the threshold for a public inquiry to be called?
Well, we have got a very thorough investigation going right now. We want to see what the results of that investigation is, and once we have those results, if it warrants further action, then we'll take that further action.
Great. Julie, I think I say hi next.
Julia Wong, CBC. This is a question for Dr. Joffe. I understand that you're saying this investigation is, quite thorough, and I appreciate that you have all these food histories that you have to go through. But it's been a really long time for some of these parents. There are a lot of unknowns. There are a lot of uncertainties, and for them, having the answer of, well, we don't know what the source of this outbreak is, just isn't good enough. I mean, what do you say to these parents?
I appreciate how challenging this is for parents, for families who are waiting for answers. Our commitment is to complete a very thorough investigation that involves multiple components. So, of course, the initial step was to culture multiple food samples. We have not yet identified E. coli from any food sample. The food histories are an important part of it. Interviewing staff, both in the daycare and in the kitchen, is another part of it. Ultimately, there are thousands of pieces of data that are brought together that have to be looked at very carefully to ultimately, hopefully, give us the answer. I think what I want to do is reassure Albertans that we are conducting a very careful and thorough investigation. We are hoping to come out with subsequent announcements about what we found, and I'm hoping that we can reassure Albertans and provide as much information as we can. I think it's much more important to do this carefully, thoroughly, and meticulously than it is to come out quickly with answers that may change. So we're committed to coming back with more information.
Julie, a follow-up?
Yeah, my follow-up is, I know that the Premier mentioned there's going to be a review of all shared kitchens that serve daycares. Have those reviews started yet? And if so, what, if any, results have there been?
Yes, no, thank you very much for the question. So we have begun the internal process of reaching out to operators right across the province to find out how many of these shared kitchen arrangements are present and how many kids are being fed from these types of food establishments. So we've just begun that work, and we'll be continuing that work until we get all the information that we require.
Thanks, Minister. Just one more question in the room, and then we're going to move to the phones. So, Catherine.
I'll have you stay at the podium. Questions for you. So, these families aren't getting payments until after the secondary spread happened. And as the Chief Medical Officer of Health mentioned, it's hard for parents. They're worried about whether they can take time off work. So why were these? What was the delay in getting these payments done?
Well, I know a lot of parents here in the province are hurting. And this has been a very traumatic experience for so many families, especially in the Calgary area. And it is my full intention to be able to get these payments sent out as quickly as possible. We're working with different ministries to be able to get the portal opened up so that families can access these funds. I know there's a lot of anxiety about when these funds will be coming out, and we're doing everything in our power to get these funds released as soon as possible.
Follow-up.
Follow-up for Dr. Joffe. I know there's different investigative avenues you're looking at. I believe the Premier had singled out potentially the handling of cold foods in transportation. I wonder if that's one avenue you're exploring, and whether you've ruled anything out, or if there's any area you're narrowed in on.
So what I would say is that there is a large team that's involved in reviewing the thousands of pieces of information that I alluded to a few minutes ago. They spend all weekend pouring through that information. They're continuing day after day pouring through that information. It will include every aspect of food handling, food transport, and distribution. as well as how the food was handled in the daycares.
Great, thanks. We're going to move to the phones. Operator, can you put through the first caller?
Thank you. Evan Kenny, CTV Edmonton.
Hi, can you hear me?
Yep, you're good.
Perfect. My question is for Minister LaGrange. Health Canada is advising people to mask up and take precautions due to the rise in viral spread. Is the province planning on sharing similar messaging?
Well, and I was able to share some messaging. I believe it was just yesterday came out in terms of we're expecting RSV and all of the additional situations that come at this time of year. Obviously, there's always an increase in flu, and we'll see an increase, I'm sure, in COVID as well, that to follow best practices. Really, the best practices are in terms of washing your hands, staying away from work if you're sick, or from school if you're sick, and also if you feel comfortable, making sure that you wear a mask.
Evan, did you have a follow-up?
Yeah, again for Minister LaGrange, what's your direction on masking in healthcare settings?
Well, healthcare settings, AHS has their the protocols that they follow, as do our seniors facilities across the province, and really it is following the protocols that they have in place, and usually it's a case-by-case situation.
Operator, can you put through the next caller?
Thank you. Terry Fikowski, CTV.
Hi, thanks for taking my question. Similarly to the previous question, I'm just wondering, Calgary Public Schools absenteeism has more than doubled during the first few weeks of school. Is there any evidence that there is a connection to the E. coli outbreak?
I don't have any information on that particular piece, so I would have to get back to you on that and look into that, but I have not been made aware that there is any connection.
And a follow-up, Terry?
Okay. Yeah, is with, respiratory illnesses, flu season, COVID, and all that coming up this fall, some parents and advocacy groups are expressing concern with class sizes, ventilation, potential shortage of staff when people do become ill. Can you speak to those concerns and any accommodations for the flu season ahead?
Well, I know through my previous role as Minister of Education that that school divisions take the health and safety of children very, very seriously. So they would be looking at all of the protocols that they have in place. As I said earlier, the sanitization, making sure all the surfaces are clean, making sure that there's availability of hand sanitizer, making sure that children do wash their hands, that all of those protocols are in place. And many school divisions did enhance their ventilation systems with the funding that was provided through the additional funding for capital maintenance and renewal funding that we had added early on. It was part of the over $1 billion that we spent on upgrades and providing supports to school through the COVID period.
Great, thank you. We have time for one last question. Operator, can you put through the last caller?
Thank you. Alex McQuaig, Western Producer.
Hi, thanks for taking my call. Just in regards to the investigation, have you been able to trace the source of the food products that were used at the kitchen for these lunches, and as well as, and if you have, are there any non-traditional wholesalers that were used by this daycare kitchen?
There is a very detailed investigation ongoing, as Dr. Joffe has indicated. Pardon me. And there's numerous food sources. I believe he indicated well over 1,400 food items that are being investigated. Am I correct on that, Dr. Joffe? Perhaps I'll turn it over to Dr. Joffe.
Thank you, Minister. The investigation is including every aspect of the food preparation, the food sourcing, the transport, the delivery, preparation in the food, in the kitchens, in the daycares. It will encompass all components of the entire chain of food, again, from where it came from to ultimately where it was consumed.
And a follow-up?
Yeah, I guess I'll just ask that question again and be very specific. Have you identified all the food source, like where the food was sourced from as of yet, or is that still yet to be completed?
The investigation is ongoing, and that is part of the investigation.
Great, thank you. That's all the time we have for today. Thank you for everyone. Anyone else follow-up questions? My name and number is at the bottom of the news release. Thank you. No, Dean, we have to let the doctor go, please. Thanks.
The owner of the kitchen actually participating, or are they not?